All right, let's talk about solutions for lower back pain, something I see all the time. I have for almost 20 years being a healthcare provider, and I am a lower back, chronic pain survivor. It's been just absolutely devastating to me at times when my back has gone out, right? And so I know what you're going through. I know it sucks. I mean, like sneezing hurts, right? Picking up something off the ground is light as a piece of paper or pencil, tying your shoes, not being able to get out there and do things you want to do and really enjoy life and then compete with your kids if you want to, just playing around or go on run a 5K, just not to be in pain, just to be able to get through the day. I totally get it. Lower back pain is terrible, and it afflicts almost all of us at one time or another, and some of us deal with it chronically. So let's talk about it today. So hi, I'm Dr. Jason McKemin, board certified naturopathic doctor with a lot of clinical know-how, knowledge, and training and skill in rehab. Especially when it comes to low back. Basically, if you're in rehab and you don't know how to take care of low back, I don't know what to say, because there's so much low back issues out there. You got to know how to deal with the low back issue with clients. Something that I've become to specialize in and gotten great results for, even if folks have been to every doctor and had every medication, even after surgery, they can still be in pain. So the few things I want to go over with you today. First, I want to flip this around so I can show you what I'm dealing with. Let's talk about the iliopsoas group, one of the primary of low back pain. Okay, sorry for the shakiness here, but bear with me. So right here we've got the anterior view, so we're looking at you if we cut away all the other tissues around there. There's just your lumbar spine, right? Here's your sacrum down there is your L5, 4, 3, 2, 1, and your last thoracic vertebrae there. And you can see this guy is called the psoas major. The minor is that little skinny dude right there. But anyway, that basically this thing is called the psoas. Comes down here and attaches to the inside of your femur here. That's what's called the lesser trochanter. But anyway, what's important is that this is a big, giant, really thick muscle that involves in either lifting your leg up, knee to chest, for example, if you're seated or standing, or it can flex your torso forward like a crunch or sit up. Okay, but you can't really palpate it, right? You can't get in there and just grab it like you can, for example, like a quad muscle. It's way inside there. So what would normally be here is intestine and bowel and what's called viscera, right? So often gets way overlooked. I'm telling you, I've had people that have been to PT and every doctor in town that still have not had this muscle assessed. And you have one on both sides. What I find is usually they're imbalanced. Very rarely are the iliopsoas muscles, or the psoas major in this case, equal. That's important. Why? If they're both tight, they're going to pull the lumbar spine toward the camera. Do you see that? It's going to pull out to the front. Now, if one is tighter, let's say the left is tighter than the right, now we have not only pulling forward, we have a rotation. These vertebral segments are going to rotate to the right. That's going to turn everything. Why? Because your thoracic spine, which is above here, it has to say, you know what? I've got to still look straight ahead to function. So guess what the thoracic spine does? It has to turn the other way. And now that that's turned to the left, your neck has to turn back to the right, and so on and so forth. These are the most influential muscles in the entire body. I'm telling you, it is almost always part of any kind of chronic pain, especially back pain. Okay? So that's one issue we got to deal with, and we'll talk about later how we can solve that, but you need to at least know about it. And then this guy out here, this kind of wider, flatter guy out there, okay? This is called the iliacus, okay? So together it's the iliopsoas, often called the iliopsoas group. They both insert at the same spot down here at this lesser trochanter, but the iliopsoas, the iliacus rather, goes over here into the inside of the ilium, which is your pelvic bone. They have, again, one on both sides typically. And again, this one also has a huge universal influence or global influence into your body, right? If, again, either side is tight, and keep in mind, both halves of your ilium, the left and the right half, these bones can move independently. See, they have the sacrum, SI joints, which are way back here that they flex at, and then you have the pubic symphysis down here. So that there's tendons right there, or rather ligaments connecting them. So these can move independently, and often, almost always with low back pain, these are out of sync. Either they're, one's got a twisted forward, one's twisted back, rotated externally, internally, all kinds of stuff can happen. And then our SI joints get out of whack. So a lot of dysfunction in there, guys, okay? So that's what we're usually dealing with the low back pain. We've got to find ways to address those muscles, usually in tightness, but sometimes in weakness, okay? Let's also talk about the influences on the spine. So those muscles I just showed you, would be attaching through these areas there, and then they're going to be coming down and pulling straight down like that. And you can see this is a pretty good spinal curve. But most people with low back pain, typically this is getting even deeper of a curve or more curved, right? Called lordosis. As those muscles pull forward. And then again, as the more the spine has to go forward this way at the lumbar, at the low back, the more it has to compensate by going out at the middle back, the thoracic spine. And then your neck has to curve extra by going forward, at least that curve up there. So often pain in that neck and low back can be due to a stiff thoracic spine. So not just are we chasing pain in the low back, but a lot of times we have to look what other parts of the spine are not working, and we work on that. Anyway, I wanted to show you a lateral view again of your spine. And in most cases, we're going to have, especially a disc issue, these discs down here are getting compressed and some nerves are being pinched. And again, you can have surgery, absolutely, and it may be necessary if you have a really bad herniation. But oftentimes, if we get this spinal column to start to move backward by loosening these hip flexors and other things we're going to talk about, we can start to relieve chronic pain on our own, or in addition to other interventions, okay? All right, bear with me on that. Let's get into a few things that we can do to start to address this. A couple things I want to point out is to never, ever, 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 ever do crunches or sit-ups if you need to have a hint of back pain. I don't recommend these even for elite athletes that I've worked with, but because crunches and sit-ups are such a poor exercise for the core. They don't even work all the core muscles. They really just work the front. They kind of beach muscles. So if you want to do a few here and there, okay, but even a hint of back pain, neck pain, any dysfunction in your body, please don't do crunches and sit-ups. Number one, ever, rest of your life. I don't care how good you feel. Stop it. All right. Another one I want you to keep in mind is internal and external rotation of your hip. That one you're going to have to look up. There's lots and lots of support out there. Just go on YouTube and look up, internal, external rotation for the hip. I'm going to give you a few stretches later, but I want you to understand that there's a lot going on at the hip level when you have typically low back pain. Almost always the hips are going to be very stiff and not allow a lot of movement in the hip joint itself. Okay, we have our femur here, then you have a femoral neck, and then we have an acetabulum. The hip makes up the hip joint. Oftentimes this joint is very stuck and tight, and then if it doesn't move or articulate very well, guess where it has to move at? The low back, the SI joints, the areas that you probably have pain in. Okay, you got to mobilize that hip joint. And then I find almost no one has glute activation, even a little, and some people have zero, like almost zero, okay? So it doesn't matter even if you have kind of a larger backside, you can still have glutes that don't fire, believe it or not. I've seen that before. And why? They were receded so much. You're in a hip flex position, meaning your knees are flexed up at 90 degrees at the hips roughly, and your glutes are just always told to be quiet, just sit down and shut up type of thing. And when you go to stand up, the glutes aren't going to magically just start firing. They've been told to shut up all day for 8 to 10 or 12 hours a day. So, and by the way, when you go to do glute exercises like a bridge or those things you might see on YouTube or, maybe a video somewhere or even a trainer, you got to be careful. They can make your back pain worse actually, because why? The glutes aren't going to turn on, remember, and you're going to go into a bridge position or a glute dominant position with weak glutes. That's not going to bode well for the low back. It's not stable. It's not ready for that type of loading. So you have to walk through a progression of loosening the hip flexors first, getting your back pain to calm down so you can get out of the sympathetic the nervous system, which is an acute response to pain. Then you can start to get into recruiting the glute. But it's a process. I'm telling you, as much as I've been doing this for years, it still can be very challenging even for me. I've dealt with this personally and hundreds of clients, actually thousands, with this issue over 20 years. But you've got to work through it in layers to get the glutes back on. Okay, stretching hip flexors is fairly straightforward. Doing some traction, fairly straightforward. But glute activation is a monster. So I'm warning you not to just go start flinging your leg in the air. In some extension thing you saw somebody at the gym do, you can make it worse. Okay, so let's talk about a strategy that you can employ. Again, go as your pain allows you to. Be smart. Use common sense. And this is not medical advice. If you're working with a physical therapist or a doc, definitely check with them. But most of the time, I get people, remember, post physical therapy or referred by other physicians, and we're able to we're a clinic that can offer advanced and alternative different types of help that those clinicians don't have or just don't have the time to teach. So, one I'm going to talk about is walking. I know, shocking, right? Really underrated activity. And walking is incredible for the body. Even if you're not in pain, you should be walking every day, okay? And don't think of it like an exercise for weight loss, okay? What does walking do? It does a million things. It can be its own meditation, but for these purposes of this video, it's going to help you restore some of that gentle rocking motion to your pelvis. Your pelvis has to rock back and forth. SI joints have to be lubricated. Also, we're pumping lymphatic fluid, cerebral spinal fluid through the body, blood, right? We're moving fluids, and we have to move fluids to get rid of waste products to bring good stuff to these tissues that we want to heal. You got to have movement for that, but it doesn't have to be running, right? You don't have to go lift weights. Of course, I wouldn't expect that with a sore back, but we can walk. Walk slowly, walk gently if you need to, walk short periods, walk for 30 seconds, take a break. Just get out there, do a little walking, okay? I highly recommend not using a treadmill. Treadmills, in fact, often cause back pain because they create an imbalance at the hip level. I recommend walking outside or somewhere safe. You can do, like actually walk across Mother Earth, okay? Breathing is big. We want to get you out of, as I mentioned before, parasympathetic, or get you into parasympathetic, out of sympathetic. So breathing 4 seconds in, 8 to 12 seconds out. Slow your respiration. Get your shoulders from stress mode, like, oh my God, I'm in pain. Get them down, okay? I know it's hard when you're in pain. I've been there. But work on breathing. That will calm your nervous system, and that leads to less pain over time. Also leads to muscles being able to turn on and do their job. When we're in sympathetic stress mode and breathing really shallow and all this is going on, your body's just going to not work well at all, no matter what you're dealing with. Self-traction is a big one. I actually do this every single day. I have a chronic condition, congenital, that I have to deal with, and I put 90% in remission. I do this before I even get out of bed, okay? But I lay in bed and I pull my knees slowly up as deep as I can toward my chest. And again, go by how I'm feeling that day. If it's a little sore, I go a little less. If I'm feeling better, I go a little bit more. I hold this for actually a good 3 to 5 minutes. It does take a while to kind of unlock that. I love doing the first thing though. But bringing those knees to the chest gets us out of, remember I showed you earlier that hyperlordic curve where people were excessively curving their lumbar spine, which is the most common curvature with back pain. When we get our knees to our chest, you're actually rotating that pelvis back. You're flattening that lumbar curve. You're creating space in between those vertebral segments. Okay, you have a gap there with the disc. You're creating space in that disc, and that relieves the nerve pain in there that you might have. It helps get nutrition in there with fluid and lymphatic fluid and synovial fluid, all fluids. That's incredible. So work on knees to chest. Work your way up to happy baby. Okay, so it's a similar position. It's just a little bit more deep. So work your way to happy baby. Look that one up. It's a yoga pose, very simple. And then once you've done that for a few weeks and you feel like you're starting to get a little momentum, okay, do this after you do the knees to chest happy baby. You can then try experimenting with hanging your legs off an elevated surface like a bed. Okay, I've done this many times to relieve, to decompress, okay? The idea is that you put your torso up on, here's the edge of the bed, right? Put your torso up here, legs are hanging down, and again, keep your feet on the ground and kind of stay supported until you kind of get the feel of this thing. And then you slowly bend your knees and allow your legs to pull down on your lower back. Again, your torso stays here, okay? And it's going to be stretching all this lumbar and sacroiliac area. It's really adding a lot of traction to that. So go easy with that, go slow. Again, work yourself up to that if you're in a lot of pain, but that can be huge because again, you're adding traction, which means subtracting stress. Add traction to the body, subtract stress, right? We're going to be able to open up that space and get some healing in there. Let's see. I would not hold that too long, by the way. If you're prone to spraining your back going out, holding that stretch, any of these stretches too long can actually put a lot of stress on the ligaments that are already tired. So remember, a few minutes and then back off, see how you feel, and then you can always do more or less later. Prone release of the iliopsoas group. Remember we talked before that one deep in the gut. You can just lay on some type of object, lacrosse ball, tennis ball. I've seen people use a small medicine ball, whatever. You have to look this one up. Again, it's too difficult to show in this video, but the idea is to try to bias one side at a time. You're going to lay on that guy, and you're going to try to just let your body weight slowly push down. Now, is it my go-to? No. Clinically here, I like to manually release that. You're going to get a lot more out of it if we can get a clinician or a practitioner to manually release that thing because it's so tight and there's so many great techniques we can do manually. And then follow up with the self-release at home with the prone. So I prefer that. I've seen a lot better success if we can manually release that first. Runner stretch is a great way to actually, after you've released or started to deactivate that iliopsoas group, the runner stretch, again, look that one up. You can then do that to try and stretch out. The idea of the runner stretch is literally taking one femur and the other femur and they're going away from each other. As you'll see once you learn that, you're basically just trying to create that separation, and that creates a great stretch of iliopsoas group. Dead bugs, okay, again, no crunches and sit-ups, but we can lay supine, which is on our back, face up, and we can slowly bring, both knees up, okay? So I'm laying here, my torso, head over here, my knees are up here, right? Or the thigh rather, knees up here, okay? So kind of a 90-degree position at the hip, like that. We're laying there, and we're going to blow out and try to engage our core with a nice breath. Again, think of cinching your waist inward, and then we're going to slowly put pressure on either leg, right? And kind of create a bracing position. You can gently move a leg in and out, all kinds of stuff. You can do dead bugs, again, you can look those up, but go slow with those. They're incredible. But when your back is unstable and the ligaments are tired, right? If even a good core exercise like that, if our leg goes too far, it can tweak that low back. So go slow with that, okay? Another one is windshield wiper stretch. This is for internal rotation. I want you to try this one out, look it up and try it out. But here's the deal. If it's easy for you to do either side and you feel like no stretch, stop doing it. That means you probably have plenty of internal rotation. Instead, go to what's called figure 4 or piriformis stretch, okay? That's gonna be external rotation. And figure out, is windshield wiper or the figure 4 piriformis, which one am I tighter at, and do more of that one? Because it's not about doing all these stretches, guys. It's about doing what your body needs, okay? If you're tighter in internal rotation, windshield wiper, do more of that and less external. Especially if you feel no stretch in piriformis or figure 4, just don't do it at all. If you feel in windshield wiper, do that more. So I want you to really get intuitive, use some common sense, and realize I've got to do what my body's telling me, not just do a list of stretches because that's what some guy on YouTube said to do. Okay, try to listen to your body, but experiment with those two things, internal versus external, which one's tighter. Also between the sides as well. Your right side, for example, might be a little stiffer, not able to rotate as far, hold that one longer. If the left leg in internal rotation with windshield wiper flops right down on the carpet, like, hey, that one's, maybe 30 seconds and leave it alone. But maybe the right we need 2 minutes of, okay? Try to correct that imbalance. I know it seems very obvious, but that's been a big secret in my program. I find people aren't taught that to get the individual differences between the symmetry of the sides. They're usually just doing the same on both sides. Big mistake, okay? All right, so that should help you guys out. I know there's a lot more we could talk about with back pain, especially low back pain, but that gives you some anatomy, some physiology, some stretches. Go through this video a few times, share it with folks that you think can benefit, because we've got a lot of hurting people out there, okay? And check out my website, drjasonnd.com. Check out my ebook, The Vital Health Breakthrough, and get going on some things that probably will help you feel better. All right, take care. Talk soon. Bye-bye.